Hi, my name is Alan Fryer, and I was diagnosed with prostate cancer the day before Thanksgiving 2011. The reason I'm doing this video is to help people understand what it's like to go through the process, because when I started looking for support groups, I really could not find any answers on the internet or in support groups that explained to me what it's like to go through it. I never got a chance to meet anybody that went through it to be able to tell me what I'm really in for. And your mind has a way of playing tricks on you, and you can get really overly stressed over something that you don't need to be overly stressed about. And this is what I'm here to do for you, trying to help you relieve some of your stress over the situation and explain to you what it's like, from my experience, what it was like to go through robotic prostate surgery, the removal of the prostate because of prostate cancer. Now at this point, I'm sure that your doctors have told you the side effects that you might have: loss of sexual function, biggie; loss of urinary control, biggie. Okay? We'll get to those things. Basically, the experience for me, I had my surgery at Florida Hospital in Orlando by Dr. Patel. My experience, this is it. I went into the hospital and changed my clothing, answered some questions, and they put me right to sleep. I went through the surgery, everything went fine. I woke up, I had a catheter, which I'm sure at this point you know you're going to have, a hose that goes into your bladder through your penis, so you can urinate. I woke up with that. Now that hose that comes out of your penis is strapped to your leg with a sticky pad to hold the hose. So all of those concerns that I had were about it coming out by itself while I'm sleeping. Oh my God, you know, it's going to be really uncomfortable. It isn't. It really is not. I really felt confident that everything was going to be fine. The sticky pad held it in place really well, and I felt really good. That I wasn't feeling a lot of pain or discomfort from it at all. Of course, with robotic prostate surgery, you have 6 to 8 arms that go in through your abdomen, and they have holes that the arms go into your abdomen through. Those were a little painful. They were painful. Not that bad. I've had surgeries before, so it really wasn't that bad. I really didn't have any pain from the surgery area as much. I was in a hospital for 1 day, and they want me to come back, and they're probably going to want you to come back within 5 days to have the catheter removed and a cystogram. So I stayed in the area. I opted to stay in the area because I live far away. I stayed in the area for 5 days. They want you to walk a lot, you know, eat no solid food, Jello, you know, broth, things like that. I did that, no problem, took the medicines like they said, came back in 5 days, had a cystogram in the same hospital. I don't know what your experience would be like, but I had a cystogram done before I had my catheter out. Cystogram was no big deal. They didn't have to like remove the catheter to do it or any of that. It was very easy, not painful at all. Then I went in to have my catheter taken out. And they're going to want you to urinate after you have your catheter taken out. They basically filled my bladder up through the hose with the catheter I already had in me. Filled my bladder, removed the catheter. That was a little uncomfortable, but it took seconds for them to do, so it isn't even worth complaining about because it happened so quickly. It's no big deal at all. They took that out, and I was able to urinate, and I was on my way home to recover. To be brutally honest with you, the worst pain I had was from the holes that went into my abdomen. I really did not have any pain from the surgery area very much at all. It was mostly the holes. I guess they're kind of like being shot. You know, you have holes in your abdomen. Yeah, they're going to hurt. Now, it's been about 3 or 4 months now since I had my surgery. Let's get to problems that really concern me. Loss of urinary control. Okay, I really have not had any loss of urinary control, but when I bear down very hard, I do have some leakage if I'm not careful. Other than that, I don't need diapers. You're not going to be walking around in diapers all the time. You're going to be fine. I bought a bunch. Don't need them. Okay? So don't worry about that. If your experience is, mine, like mine, it really hasn't been an issue. You have to do your Kegel exercises. Do everything that they tell you to do. You got to do it. Kegel exercises, all these different things that you're supposed to do, the doctor tells you to do them. They help. But I really did not have any loss of urinary control the way it was in my mind. Oh my God, I'm going to be wearing a diaper all the time. That's not the case. Okay? Now, sexual function, let's talk about that. That is an issue. Okay? When they do this prostate surgery, they kind of peel away the nerves so they can remove the prostate. A lot of these nerves, if you look at videos on the internet about robotic surgery, prostate surgery, you can see how they peel back the nerves and the veins and things. The nerves are not happy. And it takes like 6 months to a year for them to, regenerate and come around. So all these crazy things that the doctors want you to do, take Viagra, use a pump, all these things are very important to do. Even if it's not working, even if you're not getting erections, it doesn't mean that you're not going to. Okay? That was my big concern. Believe me when I tell you, I was on my way to my urologist's office a month after surgery because it wasn't working. And I'm looking for alternatives. And he's explaining to me that the nerves take a long time to regenerate. It's going to take a while for you to get back to normal. So please understand, just because it doesn't work doesn't mean the end of the world. It's going to come back. You're going to get these things back. But it's going to take time. 6 months to a year is what I'm told. So that's the good news. Not running around in a diaper. Sexual function takes 6 months to a year for you to find out where you stand. If things aren't going well after that period of time, you have alternatives. It's still not the end of the world. And the alternatives aren't that bad. So this has been my experience with the surgery. I just wanted to put this out there to try and help you guys understand what it's like to have it, and it's not as bad as you make it out to be in your mind. Actually, it was kind of nice, to be honest with you, not having to get up to go to the bathroom. That catheter was kind of fun to have. It's nice not having to go to the bathroom all the time when you have to go. But other than that, it really was not half as bad as I made it out to be. And I just wanted to put this video out there to try and help other people like myself that were out there and really concerned and freaking out, thinking it's going to be all that bad. It's really not. It's not that bad at all. And you have to be patient. And just be patient with your body. It's going to take time to recoup, and especially with that sexual function thing, man. Just be patient with it. It's going to take 6 months to a year. So I hope this has helped answer some of your questions and relieve some of your stress. Good luck to you guys, and much love to you. Have a great day.